How does creating the life of your dreams in 2016 sound? Or what about helping someone else do the same?
With Christmas approaching, the Well & You range of inspirational products is all inspiring.
Choose from vision board kits, a gratitude box, a John box, coaching packages and more. Gifts start from just $5.
To find out more, simply go to wellandyou.com. That's WELLINEUX.com and click on the Christmas catalog to help make 2016 incredible for you and the people you care about. TheWellnessCouch.com, streaming wellness into your lives. This is Up for a Chat with Cindy O'Mara, Karen Smith, and Kim Morrison.
Here we are, up for a chat about the hottest topics that are important to you, inspiring you to awaken the change within. I'm Karen Smith.
I'm Kim Morrison.
And I'm Cindy O'Mara. And today we have my dentist on the line.
Woohoo!
And Lillian Kluge is no ordinary dentist. She's a holistic dentist. And I felt that after we had, Kim and I had that conversation with Carlos, Dr. Carlos Sanchez, a couple of weeks ago, we felt that it was important that we bring a holistic dentist into the loop so people can learn about who these people are, what they're doing. There's not many of them around. I can tell you that because it took me a while to find Dr. Lillian. It took me a long time to find her, and since I found her, she's been doing some amazing things in my mouth. So welcome, Lillian.
Hello, thank you. It's nice to hear that. And yeah, there is a lot of things that we need to put in consideration when we talk about holistic dentistry, and especially in the amalgam removal.
Yeah. Lillian, can you give us a history of you wanting to be a dentist, and then what got you into holistic?
Yes, yeah. Well, holistic dentistry at first, I did not have an idea about what was that, but what comes first was my health. So I started to have some problems that I couldn't solve with general medicine, and I started to look after what could be the problem that would be environment talking, that could be affecting my work and could be affecting my health. And then I start to cut off things, and I find out that restoration that I had in amalgam was playing a role, and also at work, when you're working with the amalgam, that also goes to you. So I was in an environment that was toxic. So being a dentist, for long years, I graduated in 1994. So, and I did not have an idea before that that could be a problem.
So, Lillian, when did you start thinking? I mean, the lines that we've heard lately is that biodentistry is absolutely huge now. And in fact, where a lot of people are looking to the gut for issues, there's even a precursor to the gut now. And that is the fact that the teeth, the mouth, which is an absolute haven for toxins and infections and issues that people are overlooking, from amalgam through to BPA composite fillings through to obviously what we've been talking about with cavitations. Can you just give us an overview on where you think dentistry began and what's happened from a holistic point of view, and how it's evolved, and why there's so few of you that are actually approaching dentistry with that holistic viewpoint?
Yes. Well, why has only a little ones is not many dentists looking on holistic dentistry? I cannot tell you, because maybe they don't have that concept for holistic. And I have that concept because I look in me, and then I start to see that me as a patient, I could have those restorations removed for a material that would be aesthetic and would be also biologically acceptable to my body, and would not be as poison as restoration that is silver fillings that we call, that contains mercury on it. Okay, so if I would isolate myself and just see myself as a patient, I would say yes. Before I do anything else, I change my amalgams and see that if I will feel better after that. And that's what's happened when I chose to remove the amalgams. And I changed also my diet. And a couple of other steps that you go. That's why we do like approach not alone. We do approach with other people in the same area, like GPs and naturopaths, all working together. That's why we call holistic, because we don't work alone with the patient. We have an interaction, and each one works in their department, I would say. And when I see that I need to work in my body to see if I was with a health diet, so that diet would need to be changed as well. And then after that affects the gut, as you have mentioned as well. The gut is a kind of a second brain for us. So if your gut is not working well, nothing will work well, actually, because that it's a chain for other things. So if you want to do a detox and remove heavy metals, you need to start with your diet. So the diet would need, especially if you have gluten and if you have cow milk, that will make it more difficult for you to do a detoxification, and also will make your gut not work well. So you need to increase in proteins. So and then in your gut, you need to have the fermented foods. Cindy has a lot of things for us to help on that, because she does have products for us that it is organic, that it is a good source, and we can ferment it. And we have then a probiotic that will work in our gut and will make our gut better. So when your gut is working better, and then you will not have digestive problems as well. And if you do have, and then is where it works another professional that will have a look at what you need there to help your digestive part to work in a proper way, because you want to do elimination of toxins, and then that's one step that you need to go. So when you have that pathway by start, you have clear that. It doesn't go from one day to the other. It takes a while until you have that detoxification done. And then you move to other part. So you will work and check how is your levels of minerals, how is your levels of vitamins, and what more you need to work in conjunctions to make the whole body to work functionally and good. So you cut off.
So no one knew what amalgams or the mercury poisoning was going to do for us, obviously, and yet we've had amalgam fillings for however many decades. My grandmother had gold fillings. Can you tell us, like, why did it go to amalgam, and was mercury never considered a problem from the very beginning, or was it that we hid?
Well, I think at first they was not a concern, because they didn't put the mercury to be an issue. We have a mercury in many other substances and other medications, I would say. And they did not come up as an issue, and it's still acceptable today by the ADA. And the things that they stay in, I think, as a good material is because restoration in amalgam, they stays longer. They don't break that easy. Actually, if you do a good research, you will see that what breaks is your tooth. But sometimes I have many patients here that it comes with old amalgam and the tooth is broken, because there is an expansion that happened with the restoration there, and that it is bigger than the limit that your tooth would expand as well, and that causes cracks in the tooth. And depends where it goes, that crack, you lose the tooth, So it stays for a while because it was a cheap material, easy to place, did not have the concern with contamination with the saliva, did not have the concern with bonding, was easier to place and more affordable as well. A disadvantage was that aesthetically was not good. So that's why they start to think in other materials that could substitute the amalgam. But later on, that comes out the issue of toxicity with the mercury.
Lillian, now that you mention that, I remember years ago, I went to a Sydney dentist and he said to me, gosh, I'm just trying to think back now, it would have been like 15, 18 years ago. Mm-hmm. And he looked at my fillings and they were the amalgams and he said, they've got to go, we're going to replace them with porcelain. Mm-hmm. Is it porcelain, the white?
Yes, porcelain is one of the materials that it is white, aesthetical, and would be a good replacement. We have done, depend of the size, that's what will dictate for you what kind of material we'll place. So if it is quite a large restoration, it's a good idea to have in porcelain. If it is, if you need like more than one tooth, like in a bridge way, and it is a chewing tooth, like the back ones, the zirconia would be another material that you could work. Sometimes you combine zirconia with porcelain as well, you know. And then if it is a small restoration, a composite then would come in place. But then you need to think in the BPAs, because there is many composite restoration that it is just resins that they have BPAs on it. And that it is another concern then.
So we go from mercury poisoning to BPA, obesogenic, come endocrine disrupting disorders because of the BPA.
Exactly. So today we have many talks about BPAs, including all the plastics. So we know that if you use microwave and you put the plastic thing in there, you have the BPAs that would be plain ago. But they now having some bottles that are BPA free as well. But even for little kids, you know, for children, the bottles that they use sometimes contains BPAs. Dummies and so there is so many materials and so many things that contains BPAs that you really need to look in the label to see if that contains or not, because we know that the BPAs is very harmful for you. You can,
What are some of the symptoms that you see, Lillian, when you have a patient come in and they do have the amalgams there? What are some of the symptoms that they're presenting with that to them they've probably been living with for the last 15, 20 years and don't really know the difference, but you know because it's driven by the amalgams.
By the amalgams, yeah. That it is the difficult issue because, as you said, the patient have that amalgam for a long time and they don't associate the restoration with the problems that they might be feeling. So many patients, they complain about could not sleep properly. Some of them, they have shaking problems. Some of them, they would have headaches. That was my case. I have a kind of migraine that was increasing. I would not say that the only cause was the amalgams, but since I have done the detoxification and removed the amalgams, the migraines improve. There was a bit of a hormonal problem there as well, but I solving that part, it went, I would say, 80% better. It's only removing the amalgams. So other patients comes here and they can't sleep. That's the main thing that we can see. They have some of them would have metallic taste. And there is another issue that it is just coming up, the new research right now. It is the EMF association as well, because when you have a lot of metals in your mouth, there is a link that it can be also that you work as a galvanic reaction, and you can also have more EMFs in you because of the amalgams that you have in your mouth. Wow. So it's magnetic fields, electromagnetic fields. So it's all connected, you know. We know that if we go outside in your background, also we will be exposed to that. But if you can remove what you have in your body, that would be less, you know, it's better. We know that we cannot avoid everything because we go outside, we go in a shopping center, we will be exposed to certain things, you know. But you need to try to diminish as much as you can. You know, I have a patient here just last week that she had the whole mouth full of amalgams, and we started just with one quadrant, removing all of them. And after the first appointment that she had removed, just a couple of days later, her headaches that she had, intermittent headaches, is just gone.
Wow.
You know, so it needs more studies, of course, but it is very, I cannot regard to be a coincidence only. You know, if you do one thing, you do detoxification, and then you remove that, and the patient nearly immediately felt better.
That's amazing.
You know, so it is amazing. I have another lady that she had a shaking problem. The whole mouth started to shake, and sometimes even the eyes was shaking. And she mentioned that, and then she went to doctors, and no one could pinpoint what was. You know, and then she came and she had read in the internet that it could be some amalgams, and she knew that she had many amalgams in her mouth. She come, we start to remove. After we remove the second quadrant, the shake is gone.
Gee whiz.
You know, so you can tell me it's coincidence, but how much we will put as coincidence?
So removing these amalgams is not something that you do lightly, because you have been removing mine, Lillian. And
yes.
You know, the stuff that you go through, like, could you explain what you do when you are removing my amalgams?
Yes, of course.
Or anyone's amalgams?
Yes, yeah. Well, for Cynthia, I think she would not mind that I mentioned, but it was in the beginning. She was not really concerned. You was not really concerned, you know, with the amalgam. So I don't like to force patients. I always tell them, look, you need to research a little bit and find out that it is something that you would consider for yourself. When refusing was like that. So the first time when I see you was in 2013, I guess. We did put that question mark, and you said, look, I have that for a long time, and that it is always, many patients do the same approach. They say, oh, look, I have that for some time, never give me any trouble, so if it breaks, and then I change. Okay, and then when you say, okay, I respect your idea, you know, it's your body, in the end of the day you take the decision, but the main thing is, until you remove, you will have, every time that you chill, you will have the mercury available, and that would be going somewhere. With the mercury, they always go to the fat tissue, and it is difficult to get elimination of that. So because of that, Cindy is very familiar, and Kim now is start to see, she has been here as well, and she knows how we look at that. We do have a protocol that needs to be followed. It's not that you have the amalgam, then you go in the first dentist and you start to remove, because if you don't go for a correct protocol, you can have more issues. You can end up with autoimmune disease as well, because when is the time that you'll be mostly exposed to the mercury? Would it be when you place, because then you are manipulating, and that is, the mercury is in the air. And the other time it is when you're removing, because when you remove, you need to drill. That will generate a heat, and the vapors of the mercury would be also be in the air, and you'll be inhaling that, you know. So you need to be careful when you remove. And for me, it took a while for me to realize that, because I was needing a lot of studies on that. And I realized that every time that I was removing the amalgam of some patient, I was being also getting that vapor in the air, and I was getting the mercury. You know, so I was need to change. Kim know, and Cindy know. I have a totally new practice now. Sunshine Dental Care has invest in a way that since the plumbing here, all the chairs, they're all new. So we have special filters that will look after that we will not only remove the amalgam, and that will be displaced in the environment. So it will be filtered. When you are in a chair, like Cindy has notes last time. We prepare first with that protocol, like we have mentioned. We look in the gut, we look in digestion, we look in all the minerals and everything. So your body is already prepared to work with the amalgam, and we'll have supplements in there that it is mainly the zinc and selenium and chlorella and coriander, things like that, that will help you with the detoxification, and that will help you do the elimination. So once you have that for a couple of days at least in your body, if you are a health person, it varies from one person to the other, depends how good you are in your health. But after that, if you are sitting in a chair, let's say you have done all the rest, you will be with your tooth totally isolate. So we only work on that tooth that contains amalgam. Usually I go by quadrant. I don't want to cross the midline, just not to interfere with your immune system as well. And we will not coincide with the same day as well in a week, because we know that our immune system has a 7-day cycle, and we want also to respect that day, because if we coincide, we can have an overload on that day, and that damage your immune system, and that can cause autoimmune disease. So we remove in a protocol with rubber dam, the tooth is isolate, and then we have the air filtration as well, that will be bring close to your mouth, and that's a kind of a vacuum cleaner that will be vacuum all the air and the filtering everything. That air is a Swiss-made machine and has 6 filters on it, and we'll capture as much as we can. It's still, of course, a bit probably will go in the air and we can't see, but with that, you minimize in a very, very little amount that will be exposed. And then, in conjunction with that, we also use O3, so it's ozonating water, that also clean and will boost your body with pure oxygen. So we use the oxygen as well to boost your body, okay? Because that helps you to have a better elimination and your body fresh with fresh oxygen. And then after that, you replace with, of course, with a biological material.
You take such care, in order to do this. And I take my hat off to you, Lillian, because
thank you.
Like you're exposing yourself to this all the time, and that's why you have created such an amazing protocol in order to get the amalgams out. And I am happy to say that I only have a few to go.
Yes.
Yeah, we're slowly getting rid of them, and I'd say they'll all be gone hopefully by
right.
next year.
Yeah. So we are now just in in 2 that we need. So in there, not too big. But the other thing that we need to make it clear is that once you start to have the amalgam, of course, the ideal is that you remove as sooner as you can, because then you stay in that protocol, the stricter protocol for that period, and then after that you will be in a kind of a maintenance. Okay, and then the very important part is that you continue with the vitamin C, and you do a flush, a detox, a flush for your body once a month. Okay, because as I mentioned before, the mercury, they will go for your fat tissue. And to remove from there, it's not easy. It's not just doing exercise and sweating a little bit and you'll be eliminating the mercury, because they will be storage in your fat tissue. Okay, so that's why you need, for at least 6 months after you remove all the amalgams, you need to continue doing that flush once a month.
And how do you do that flush?
Usually I recommend we're using vitamin C. So you take a higher amount of vitamin C, and it's a day that you need to be at home, of course, because you need to be comfortable. That you know that you need to go to the toilet many times.
Are you talking about ascorbic acid? Like, do you get it like that, or are you talking about camu? Do you just take lots of camu?
Yes, you need to take a camu until you go to the toilet, I would say.
Wow.
And one of the things that we're doing with the camu for people who can't handle the carbohydrate, because it's a fruit, it's not straight ascorbic acid, it's a fruit. And one of the things that I've come up with is I use the cultured wellness cultures. I make up a juice, and I make that up of beetroot and carrot and apple and ginger, and I even put garlic and a bit of onion in. And then I add heaping tablespoons of the camu camu, and then I ferment that for between 24 and 36 hours out on the bench. And then drinking that, it means that what the ferments have done is that, number one, you've got the ferment coming in, so it's going to help clean out your gut. But number two is it's eaten all the carbohydrates,
Exactly.
and it makes it easier because, everybody knows what I'm like, Lillian. I know how ascorbic acid's made, and I understand there is a reason to use it, especially in flushes. But I try to do it as naturally as I possibly can. So people can choose. They can put the little bit of effort in and do it that way, or they can choose to, grab some. I think the latest thing is the fat and the vitamin C. It's what's it called? The lipo vitamin C. And I've noticed that a couple of the prescribing vitamin and mineral companies, the ones through the natural therapists and natural dentists and chiropractors and everything, they're bringing one out in the next couple of weeks. And it's attached to fat, and apparently the vitamin C works far better that way. So when I find out more about it and when I learn out more about it, then I'll let people know what's happening there.
That's fantastic.
Yeah. Another question I have. So, number one, what's amalgam fillings made up of? What's the percentage of mercury?
Well, the percentage of the mercury is quite high. Depends, because there is companies that works with a different percent, but in most of them is almost 50% is mercury. It is.
Whatever made us think that it was okay to put that in our mouths? And I know I heard your explanation of the whole thing, but I always wonder, and it's the whole BPA thing. I remember when my kids were little, they were the dentists were putting sealants over their teeth so they wouldn't get whole. Now, what were they made out of, and have they got BPA in them?
Depends of the sealant will have BPAs. Yes, that is a concern. I have a couple of children that come here, and the moms don't know that, and I bring that subject as well. And most of them will have BPAs on it. So it's not many of those that doesn't have, but nowadays I do have here available for my patients without BPAs. Yeah.
So can you take those sealants off?
Yes, you gotta. Well, when it is just a fissure seal, it's easy because it is just in a fissure. So you scrub. Usually, you can even remove with ultrasound, and that will come up, and you just replace that with the normal one. But when it is a restoration, depends of the size of the restoration, that it can be an issue because is the same color as the tooth. So you need to know that always when you replace that restoration, a bit of your sound tooth would be sacrificed as well. So that's what it is quite hard, so we try to do in a way that it is preserving the tooth as much as we can. But always I recommend to the patient, if it is a large restoration, I would say considering more than half of the tooth we need to be replaced, I would recommend to do that restoration in porcelain. Okay. If it is a full crown, you can either choose to a porcelain or the zirconium. If it is a small restoration, we do have available BPAs and hammer-free as well. If it is just a fissure seal, you need to look for the sealant that contains no BPA as well, which is not many. But there is another thing that you need to use it as well, what we call just a bonding material. That will be the one that will glue the resin with your tooth. That also needs to be BPA free, because that goes underneath So there is so many materials that we use in dentistry that you need to evaluate all of them. It's not possible to eliminate all of them, but the majority you can.
A lot of people will say things like, none of us are qualified dentists. So when we go to the dentist, we are trusting exactly what they say. So you could say that we've got BPA-free sealants or BPA composites, and yet the glue or the composite stuff that you're talking about, the compound that you put in to glue it in there, has got BPA. Now, they're not lying by saying that the replacement filling or whatever is not BPA, but how do they know and they wouldn't tell you? Or is there... I mean, there's very few of you dentists talking like this. And
exactly. Well, I can't tell you if they don't know or not. I think many of them would not know because they are not in that study. They probably not being aware about it. Some of them would, and they would just choose not to tell you. And there is also... I would say those that will be like I am here. I always tell you which material you want to choose. We have materials that has BPAs and material that has not, and I tell you the difference between one and the other. Okay, so the patient usually they would know if they ask. And sometimes they can be as well a bit more informed if they know the name of the material, and they can go and they do their own research, which nowadays is even more and more common to do that. You know.
Can we move on and ask about fluoride? Like, what is the whole kerfuffle that's happened with fluoride? Why are we being offered fluoride still, and why is there such a big... Or how are you overcoming the whole fluoride treatments issues and whether or not children should be having fluoride in their toothpaste?
Well, fluoride is a big concern, I would say, because if you talk alone, if I would just see the tooth and I would not consider the general health, I would say, yes, fluoride is good for the tooth. It will help you with decay. However, what causes the decay? So if we go for that analogy, what causes the decay is if you don't clean your teeth properly and you let plaque build up on there, that will form an acidity environment with bacteria, and that the bacteria will form that acidity environment, and that will attack your tooth, and eventually you will have decay. So how you want to address that? If you, like I come from Brazil, and in there we have done a study on that. And not because we have an issue with the fluoride, but because the children there, they were poor and they could not buy toothpaste. So we were looking for an alternative, how they could clean their mouth and they would still not have the decays. And we have done a study that we put totally out any toothpaste just because they could not afford to buy. And we just let them clean their mouth with water, just using the toothbrush and water. And we have done that for a couple of months, and every month we was analyzing and see what was going to change. And we know after years, because this project that was in there, it goes for years, they call Zero Decay, the name of the project in there. I don't know if it's still running. Probably not, because that was when I was in university. That so was in 96, 97. So on that time we have analyzed after a couple of years, and we noticed that the children that was under that protocol, only brushing their teeth with water, they were with zero decay. And that comes up with a study that was done in Finland as well, because they have the lowest index of decay. And we analyzed why, and was because of they put all the effort on the prevention. And the prevention was what caused decay is bacteria and acidity caused by that bacteria that will make a hole in your tooth. Okay, so if you take out that cause, which is sugar, yeah, so if you give a lot of sugar for your children, they will have that food for the bacteria, right? So you don't need the fluoride for that. So
interesting.
If you only clean your tooth properly, it doesn't matter with what, you don't need the fluoride, because you are removing the substrate that it is the food for the bacteria that is causing decay. So if you want to eliminate decay, you need to attack the cause. So what it is the cause? You know?
So what about fluoride in the water, Lillian? Are you allowed to make a comment on that, or is that like doctors commenting on things they're not allowed to comment on? Are you allowed to comment on the fluoride in the water?
I'm probably not allowed to say anything about it, but I can tell you what I can say to you is what we just say. If the fluoride has been placed in the water to prevent decay, why should we not invest in removing the cause of the decay? Because it does. I can ask yourself, you think if you have a child that has a lot of decays, or even yourself, you have one decay, let's treat you only with a fluoride. We don't do a restoration, we leave it there. We don't change your diet, we don't do anything. We just put fluoride there. You think that will help?
Good point.
Yeah. So,
very good point. I think it'll make people think.
Yeah. So it's not. When you want to attack the problem, you need to remove the cause.
Sounds like cows. Your accent sounds like remove the cows.
Well, I'm a Brazilian. So unfortunately, I think some of the words, my accent will not change. I try my best. I'm sorry about that.
Can I ask a question now then about the all elusive root canal?
Yes.
What is it? Why do people have to have it? And what's your concerns? And most holistic dentists will do everything to avoid it. Why is that?
Yes, well, that it is another polemic issue as well. So usually it's difficult to deal with that because, first of all, what it is the root canal, as you said? What would be the situation where you will be dealing with that situation that you say, okay, I need the root canal. You don't need the root canal if you don't have a nerve involvement. Okay, so of course there is sometimes periodontically as well cause a problem in the nerve. But let's say if you need the root canal is because you have a nerve problem. Okay, and then you need to drill. And you need to assess the nerve, and means drilling in the tooth and removing that nerve, clean, and placing a material in there. However, when we analyze the shape of the tooth, it's nearly impossible to remove all the bacteria. And the other thing is, most of the people, they will not go to a specialist to do the root canal treatment. They go in any dentist, and many dentists do the root canal treatment. I'm not saying that the not specialist dentists would not do a good treatment. There is many just general dentists that they will do preparation and root canal treatment as good as the specialists because they do so many times. They might be used to, but that's not what happened with the majority of them. So the majority of them, it will not be treated properly. The tooth will not be cleaned properly, and that will make like you put some material there in the canal, packing up bacteria underneath. Okay, and that bacteria with the years, it will cause you more problems. Because it will form what we mentioned, the cavitation, and the bacteria will be always alive in there. And there, nowadays, we have studies. Of course, there is a lot of studies that start from many, many years ago. Everyone will talk about the holistic dentistry. It started with Dr. Preston, and they say, there is no scientific evidence for that. However, we know by the how can I say, I'm just missing the word now, but the way that the canal is, there is so many tubules that it is connected to that tooth, and you cannot fill it up all of them, and you cannot clean up all of them, and bacteria is microscopic. Okay, so you will kill the majority of them. But even if you do the root canal with the best endodontics, you still will have a small percentage in there that it is a live bacteria. And through the years that it can grow and then cause you another problem. Sometimes they would say, we just need to retreat the canal and then that will fix the problem. If you say in terms of teeth, in terms of the mastication, yeah, maybe that fixed the problem. However, there is cavitations and other problems in your general health that it might be linked with that tooth and you don't know. And that would not be solved by a root canal treatment. You know, because the bacteria, they will go in a chain and they will stop somewhere in your body and cause you an issue, and sometimes very difficult for the doctor to find out that that comes from the tooth. So that's where we work with the meridians, the tooth meridians, and we find out each tooth is connected with which organ or with which gland. Okay,
Which today, I have to say, sitting there and you talking about my tooth that's got a problem, one in particular, the particular meridian line, Cindy, is joints and lower back.
Oh, yeah, that's
wow.
we have this discussion today in the morning.
Wow. Yeah.
So,
wow.
and then with that, we say, is that coincidence? So what I say to the patient that they come the first time, and like Kim, she is a healthy lady. She always looking in her food, and she does everything to be healthy and organic. And suddenly after procedure, you start to have a chronic problem, and that chronic problem cannot be solved. And then what you will think that is solving? Then you will look in your teeth and see if there is any relationship between that and the tooth. So I say, if that problem starts after a dental procedure, you're likely to be related to the tooth.
Oh my goodness.
Yeah.
Geez, it just opens up a whole other place to look. But I guess it makes sense, though. I mean, everything is connected to everything, and no one thing stands on its own inside of the body. So it really does make sense. It's just,
yeah,
you know, I think, where does a person start then? but I guess it does. It makes practical sense to start with the beginning of the digestive system.
Yes,
isn't it?
Mm-hmm. Yeah, that is very good, because it's everything linked to each other. We are one body, and everything is linked. You know, so if one thing is not working properly, we will have a kind of a compensation. We'll be using more to the other one. And that's what is caused. That's what we say, like in case of Kim, she started to have this chronic back pain. And it's very difficult when it's to find out exactly where it starts and how it starts. But the coincidence is there. So then we know at least where we need to address to maybe find the solution. You know, but it is not an easy way. That's why you need to study a lot, and you need to go in different. I work like Carlos. He is also looking for Kim, and he will have a say on that, and then we'll say, okay, we will look on this to see if that fix. If not, we can look in this other thing, and then by the end, the common thing it is that we will have the patient look in all the angles, and we can solve the problem.
It's almost like investigation. So at the moment you go to your doctor, they find a symptom, they give a medication, and you go away because that medication has taken the symptom away. Exactly. But eventually the body breaks down, and I feel, Lillian, is what you and Carlos do and many holistic dentists that I'm learning about and holistic doctors. It's almost like you're investigating. Yeah. And you're not just saying, well, that's your symptom, take this drug. You're actually going through an investigative process. And for many people, they don't ever have that. They don't have anybody doing that for them. And it's. I find it really hard. I've been listening to a doctor out of MIT, out of Boston, and he and another gentleman, he's called Dr. K and the other one's called Dr. Fasano. and they have a 5-year waiting list because all they do is investigate chronic problems holistically. And people can't wait 5 years if they're sick. So I feel so lucky that on the Sunshine Coast we have some wonderful holistic practitioners, from chiropractors to dentistry. And you know what? I never could understand why someone wanted to be a dentist. Why would you ever want to look down that mouth? But I actually
share your view, Cindy.
Yeah, exactly. But I actually, for the first time in my life, understand this profession and the importance of this profession and the importance that we do the right thing by people, from tooth extractions to root canals to the fillings that we use to the amalgams that we take out to how we clean our mouths. I just I'm in awe. I'm in absolute awe of what's happening.
They're almost becoming like the I don't know about you girls, but I feel like over the course of us doing our podcast over the last 3 years, it's like we started in the mind, and we know that the mind was everything. Then we've moved gradually into our nutrition, and then we've moved from nutrition into kind of self-care, and now we've gone into the gut, and now we've gone. It's like every level we keep going deeper into each one, and then it expands, and now realizing that the dentistry, biodentistry, is such it's obviously an incredibly definitive and very incredibly strong part of our whole health and the way our health is. Would you not say?
Yes, definitely. It's kind of artistic to work, I would say, and you need to love what you do, to look in all this angle.
Well, I was highly embarrassed at the fact that now these days you have these bloody cameras. So you think that just the dentist.
I love that camera. I like looking at it.
And Lillian's holding the camera and goes, "See the plaque here?" And I'm like, "Oh my gosh, is that what you have to look at?"
Yeah.
My eyes. But now you've got a screen in front of me showing it to me. Sure, that's a motivation to floss, I can tell you.
Yes, yes. You must see what you have.
Oh, I can't bear it.
Yeah.
Actually, Karen, I didn't think I'd be able to bear it. But when Lillian takes screenshots of your mouth or is moving the camera around your mouth, I actually find it really fascinating now. Well, because, we've been so blinded by what's happening in our mouth. The more I listen to Lillian and the whole thing about holistic dentistry, the more I realise we need to be educated about this. We need to ask questions. We just seems to have just open your mouth. Yes, we'll do that. Let's throw that filling in. That's what it was done to me as a teenager. I didn't know any different. My parents knew no different. We went to the local dentist. He filled everybody's mouth with amalgam. I'm sure my holes weren't as big as the amalgams that are coming out. He just drilled the whole tooth out and then threw it with mercury. And that's what it infuriates me.
Cindy, I'm with you, but I don't know about you girls, and I'm sorry, I don't mean this in a generalised form, but there's a reason why we used to call it the murder house. Like, it was seriously like the most scariest place to go. We always all hated it. There's a lot of people that really do have a phobia around dentistry. And I have to say to you, Lillian, there's a lot of dentists out there that are very barbaric. They're very brutal. And I know that for having my wisdom teeth removed. I have never felt so violated, upset, hurt, and traumatised. And I'm not being dramatic here. Cindy saw me afterwards. I know.
It's horrible.
Yeah, it's not nice to hear that, because I hear that sometimes, very often, I would say, from patients, and that's where nowadays I think there is many people just having the numbers in front of them, and they don't see the priorities, or that they just need to do that number, And with patient, you can't do that. You need to look in general. You need to spend time. You need to be there and doing the things in in a way. So I always hear, sometimes I get behind of sometimes pretty often I would say I get behind because I don't let myself to do the things quickly just because the next one is in line. You can apologize for people and say, look, this one here took a little bit longer. Of course, you estimate the time that you need, but sometimes it does need more time. But you cannot make that, okay, I will just make a quick thing now, and that's it. The work is done. You need to do the things and give the priority that you want to do your best in there. And I think that's it's a shame because sometimes people get traumatized, and when they do get traumatized, the fear comes, and always then the second time when they go, it doesn't matter if they change the dentist or not, the memory will be there, and sometimes it's difficult to deal with that because you need to get that phobia away. And I'm glad that I have some patient that comes here with a big phobia from dentistry.
Oh, it sounds to me like we might have lost Lillian there for a moment.
Yeah. I can't hear her.
Just as Lillian's speaking, I'm casted back to my most recent experience at the dentist. I used to have the spunkiest dentist in the world in Sydney. This guy, he looked like Elvis. And the worst thing is to have a spunky dentist because it's very unattractive. You're lying there, they can see straight up your nose, you've got dribble going everywhere, it's all bad. And I just used to love going to see him because he was so
Hello?
hot.
I think I lost you girls.
We've got you back, Lillian.
We've got you back, Lillian.
Sorry about that, but it comes something, another call here and they cut it off.
Karen was telling us all about her hot, hunky dentist that she used to go to. So,
yes.
But then the worst thing was when I moved from Sydney up to the Sunshine Coast, I never found a good dentist. And the very last dentist that I went to, because I've smashed one of my back molars, and I went to the last dentist, and I'm not joking, as soon as I sat in that chair and they brought that light down over my face, I had a panic attack. I got up out of the chair and I ran as fast as I possibly could, and I've just tolerated my smashed up back tooth. And then on the paperwork,
that's terrible.
On the paperwork, the dentist said to me, "Is there anything more we should know?" And I put in big bold letters, "Yes, I'm terrified."
Yeah.
Homeopathics and oils and what do you say to people that are terrified of the murder a dentist?
Yeah, that's what I want to know. That's what I want to know because it stops. It stopped me from going to the dentist with a smashed tooth. So I'm just tolerating it. I'm really interested to see what you do with patients that are freaked out and traumatized because I dare say there'd be lots of us, surely. Please tell me there are.
No, there is a lot to him. Yeah, so I have some patient. I would say we always need to start with a consultation and have a good talk and try to find out from where it comes the trauma. Okay, so we spend a little bit of time and find out, and then sometimes it's just that you need to spend more time with the patient and build up that confidence in the patient, and they will be fine. Other times they are really, really scary, and they would not let you do anything apart from the examination. Some of them would not do the examination, but they would need to be sedated. Okay, so we would offer then sedation, which would be a professional that would come and would administrate like intravenous sedation for that patient in particular. Some of them, that's the only way that they have, because they can't open the mouth because all that memories will come in their mind, and that would not let them let me do the work. So when they are sedate them, it helps both. I can do the work, and they also will have a pleasant time. They would not remember about the procedure.
Karen, that might be what you need.
You know what? I'm sitting here thinking to myself, okay, first things first, both you, Cindy and Kim, you have to come with me, one on each side.
Lillian needs to get in there somewhere, Karen. We can't be on either side of you.
Well, we have our dental assistant here. She's a lovely girl as well, and she usually helps the patients quite a lot. She can give you a hand as well.
Is she a trained psychologist? Is she? Is that
Why is it that I'm always the freak? You know, in all of these.
Yeah.
true?
Well, Karen,
so
that would
funny.
be maybe your case next time that we see you.
Right.
You can come with Kim or with Cindy here, and they can give you a hand for you. I'm quite all right on that.
Well, I can tell you now, there's no way I'd be doing it any other way.
Oh, you're funny.
We'll come and laugh. I mean, look after you, sweetheart. We will.
Yes, you would come and laugh. I know you would. You would take photos of me and put them on Facebook. I know. And you would get selfies of you cracking up laughing.
No, we wouldn't do that.
Imagine getting Karen with dribble all down her face. I'd love it. I'd just.
We'll get photos and we'll put it up on the podcast. Hey, can I just?
Oh, sorry.
I was just going to ask about oil pulling because I got a text from Kim this morning. Oil pulling, really? So could you talk about oil pulling? Is that something that you advise, and what's the point of it?
Oh, we lost her.
Hello, sorry.
Yes,
If someone insisting to call. Okay, oil pulling you was talking about, isn't it?
Yeah.
Yeah, oil pulling, it's a very good way to help. I have many patients that they have periodontal problems, and I recommend them to do of course you need to do a good cleaning first, and then you start to do the oil pulling. So you can use many types of oil, but my preferred one would be the coconut oil. Okay, so the oil pulling you need to have like a full tablespoon, and you will be swishing in your mouth for about at least 10 minutes. Okay, so it would be from 10 to 20 minutes. I would say most of the people would do 10 minutes, 10, 15 minutes. Okay. And the pulling also, they help remineralize your tooth and it strengthens your gums as well. And apart from that, they clean the whole area. It is good. I have patients that the teeth were very mobile with periodontal problem. We have done a good professional cleaning and ask the patient to start to have the oil pulling. And with that, the tooth becomes stable again. You know?
So I have to say to you that after my good clean today, I came to the office and said to the girls, I can't talk, I'm oil pulling. And I think I did 2 tablespoons of oil. My mouth was quite full. And and I had 2 drops of spearmint oil. And I can tell you within 30 seconds, my mouth was actually quite fatigued. So clearly I have not got strength or muscles. And when you were talking about how it can strengthen the ligaments around the tooth, I was thinking, oh my gosh, this is like, I'm actually doing a workout. I thought I did enough of a workout with the amount of talking I do. But with the oil swishing, it was like such a different feeling. And I've done it for a little while before, but only a minute or 2 because I didn't think it mattered. But I did it for a good 10 to 15 minutes. And my mouth actually felt really amazing. And especially with a drop or 2 of peppermint or spearmint, it just had such a refreshing feeling.
Yeah, it does make a difference. But you cannot forget that after you do that, you need to spit it all out and then brush your teeth because you don't want to swallow any of those bacteria or anything that comes out from the oil pulling.
Oh, I didn't brush my teeth.
Here we go. So it's good that you know, and then you do that then.
Lillian, the thought of swallowing that, we're not good at swallowing in this camp, so we'll just stick to spitting that one.
What sort of oil did you use, Kimmy?
Coconut oil.
Coconut oil.
With the 2 drops of spearmint. Lillian, one other question, because I know we're coming to the end, just very quickly. It's something I get asked all the time.
Not a problem. It has been a pleasure be talking with you girls.
Having a squeeze of half a lemon and water in the morning, is that okay for the teeth or not okay? We know it helps the digestive tract, but is it good for the teeth?
Well, that was very good things to comment now, to just for us to finalize, because lemon and some people would do, even I myself was doing apple cider vinegar with the mother. it does help a lot your body, but you need to do some precautions on there because it is acid. Okay, and I have a lot of person that was doing that for years, and they start to have erosions in the teeth because they drink. So when you drink, the first teeth that will be attacked is the anteriors. And if you do that very regularly, every day, with acid thing, it can give you erosion. So what I would recommend you to do is to do that, but using a straw. So you swallow with a straw.
Okay, good idea.
Yeah. So that then you will drink, you will get the benefit of that, but you will not cause the erosion for your teeth.
So what about one of my favourite drinks when I get home at night is a little bit of ice with some mineral water and about a tablespoon with a tablespoon of apple cider vinegar. I really love it. Is that a small amount enough to do that, or would I still need the straw?
If you have like a full tablespoon of apple cider vinegar, I would drink with a straw.
Oh, wow. Okay, even 1 tablespoon in a whole glass of water.
Yeah.
Okay.
Yeah,
okay.
You can measure the pH of the water, and you will see that it is quite acid.
Okay, thank you. That's such a good tip.
Yeah.
How fascinating.
That's very nice.
Yeah.
There is so many things more that we can talk and discuss. And as you said, when we talk about that, it opens a big thing that sometimes we don't finish the subject because we just jump in another and then goes deeper and it goes on and on and on. So that's why it's very important to work together with other professionals as well. So each one you look in your area. And here, so we have in a practice here in Sunshine Dental Care, we do that in a way that we talk always. I say, I want to know which naturopath you work. So we write a letter and look, that's in my findings, and you can tell me what is your findings, and we can work together for the benefit of the patient, And then when it ends, when you have all the removal, we also communicate and say, look, that's now my part has finished. So the patient will go for a maintenance, but you still need to work in something else with the patient, And I'm very glad to have Cindy because she brings a lot of things good as well that it just help us, because the other problem that we see that when I start with my detoxification program, we put a lot of things in there, and then the next question of the patient would be, okay, where did I find that? Because they want to do the things in the right way, but they don't know where to get the products. So I'm very glad that Cindy opened for us a link that we can go straight away, and we look together here with the protocol, and if the patient have that problem, we say, look, here it is. We give that link for you, and we know that it is organic, that Cindy looks after the material that it is there. We know that it is not synthetic, because there is a lot of synthetic material that it is vitamins especially. So we know that the source where we want to send it is a good source, And
thank you, Lillian.
Yeah, no, that's very important, because we need to support the patient, and not only give the protocol, we need to tell them where they can get the right things. Yeah.
And I think that's the key, isn't it? I mean, people, if they know better, then they can do better. But
Yes.
for the most part, people don't even know that these are issues, much less know where to go to get them fixed, or what to do to enhance their experience or make themselves well, or where to even start looking. Most people are pretty ignorant to this sort of thing, and I think that being able to talk to you about it is just exceptional.
Thank you.
How can our listeners actually find you or research you, find out more about you?
Okay, I'll thank you to give me that opportunity. We are here in Maroochydore, is in the heart of Sunshine Coast. We are in the Emporio Place. The practice name is Sunshine Dental Care, If you look in the internet, we have our Facebook as well. If you look for toxin-free Sunshine Dental Care, we have the Facebook there, and there is a lot of tips on there. And I probably will, with the permission of Cindy, we might put some links that go to her as well, because then people knows where they can find the things. But we have the website sunshinedentalcare.com.au that will explain a little bit more as well. And we are in the Emporio Place, which is close to the Marichdor Home Center, just opposite to Have Norma, as Emporio Place, 501.
Fantastic.
Yeah.
Oh, wonderful.
Fabulous.
Would you like that I give our telephone? Or
Yeah, absolutely. Why
definitely.
not?
if someone would like to call us, our phone is 07 5475 4866.
And I would just like to add a little bit here, and because sometimes we don't associate a dental procedure with ill health, and it'd be good for people to start thinking about, well, when did they start to get sick? What was it that happened? And that's what we were doing with Kim, wasn't it? Kim?
Yeah, exactly.
So it's exciting that we're finding out all of this wonderful information. So thank you, Lillian. I really appreciate you coming on the call, and I know how busy you are.
Thank you. Thank you for giving me the opportunity.
Lillian, thank you for changing your clients around to be with us this afternoon, because we know that our beautiful listeners, they really are very loyal and very interested in all that we're interested in. And at the moment, dentistry is a hot topic for all three of us. So we're very grateful for your time and your knowledge, and incredibly grateful that there's a group of dentists that are really becoming very mindful of the importance of how to approach this care for those of us that are looking at it holistically. So on behalf of mankind, I would like to say thank you.
Oh, thank you, girls, and you are fantastic girls as well, because you bring that news for people. And as you said, when the information goes further, that's where sometimes would be the start for someone, and you make that possible that everyone can hear. And if they are around us here, they know where to come. And for definitely, we will look very carefully in each case and work separately, individually, to find the best solution for each one of them.
Oh, that's fabulous. Well, you've encouraged me. You've inspired me.
Yes, maybe the next one will be you, Karen.
I think so.
I'm looking forward to see you, and we will make the best to work out in the best way to treat you.
Well, that's very sweet, but I know what you really mean is you're looking forward to laughing at me. I know.
No. Well, a good laugh, it's also good. It's good for the spirits.
Well, I will gratefully provide you with entertainment. No problem at all.
That's nice, Karen.
Lillian, this has been an exceptional show, and I know that everybody listening to today's show will have gotten so much out of it. So as Kim said, thank you so much from the bottom of our bottoms for doing the work that you do, because obviously there's a huge need for holistic dentistry, and we're all getting this incredible wake-up call about how it contributes to our health and well-being. So thank you so much for being a part of the ride and for sharing yourself with us and all of our listeners.
Oh, thank you. Thank you, you. Yeah.
So for everybody who's listened to today's show, we certainly hope that you've loved it as much as we have. Go all the way across to our Facebook page at allthews.facebook.com/up-for-a-chat and post all of your questions and all of your comments for Lillian right there, and we'll make sure that she gets them. Also, you can go to allthews.thewellnesscouch.com/up-for-a-chat, and you can post your comments and your questions there as well. And we love to hear from you guys, so please keep your feedback coming. It's been an absolute treat sharing 2015 with you guys. So make sure that you keep sending us your comments, your questions, and your requests, and anything that you want us to do shows on. So it keeps it alive for us, and we love it. So join us here next week on Up for a Chat and become part of the ripple effect that's changing the world. And we're going to see you on the ride. Bye for now, everybody.
This has been a production of TheWellnessCouch.com. Check us out on Facebook and join in the conversation on Facebook.com/The Wellness Couch. Subscribe to each show on iTunes and check us out on Twitter. The Wellness Couch, streaming wellness into your lives. Whilst the Wellness Couch presenter endeavor to provide accurate and helpful information to their listeners, these podcasts cannot take into account individual circumstances and are not intended to be a substitute for health and medical advice from a qualified health professional. You should always seek the advice of a qualified health professional before acting on any of the information provided by any of the Wellness Couch podcasts.